Hey guys, it's Cindy. Shout out to Cody for talking to me yesterday. He just wanted to know kind of what SCS systems I prefer. And I know this is a very individualized topic, but I just wanted to go through each company that I consider and talk to you about my thought process behind it and the evidence. So at my fellowship at Case, we used a lot of Boston Scientific. So that's the one I'm most familiar with. And so Boston specifically, the SCS uses the FAST technology, and FAST stands for fast acting subperception therapy. And this gives the patient paresthesia-free pain relief in minutes, like literally minutes, and it's sustained for years. And this is designed to help reduce habituation and minimize the interaction that the patient needs to like adjust their device. It's like I said, it takes minutes. So within 1 or 2 days of subperception therapy, you'll already know if it's helping or working. Nevro is also a subperception therapy system, but it does take longer, I think, from my understanding. We did use Nevro too a little bit. This one, there's the 2-2-2 concept that supports this FAST technology. And what it stands for is 2 minutes of pain, and in about 2 minutes, you'll see pain relief. That the patients will also have about a 2 of the numeric, the NRS pain scale score, and they have 2-year outcomes. So that's just kind of a way to remember evidence behind it if you need to talk about it. The FAST also has a new system where they have a fast auto dose option, which you can basically schedule like doses per the patient request, so they don't have to do it manually every day. As far as evidence, 2 main ones are the ProCo RCT and the Whisper RCT. The ProCo one, it was a multi-center double-blind crossover that evaluated frequencies from 1 to 10 kilohertz. And they found that there was no difference in pain relief between 1 and 10 kilohertz. So does the 10 kilohertz really matter? According to this one, it doesn't. And then the Whisper RCT is when the patients were given option to choose supraperception or subperception, or the option to have both. And they found that the patients that had the option to use one or the other had a 62% increase in their success rate versus if they were only given one choice. And then the Spectra study, or Spectra Waverider observational study, it just showed that Boston Scientific can run multiple wavelength frequencies all at one time, and that 2/3 of the patients had pain less than 2, like this 2-2-2 thing, and 1 out of every 4 said they had 0 pain. And they can do both paresthesia and paresthesia-free at the same time. So I know that was a lot of information on Boston Scientific, but I really like how there are a lot of options for the patient and how fast you can see the results. As far as Nevro, they use obviously the 10 kilohertz therapy. And this one does not rely on intra-op paresthesia mapping like other companies. You just place them and you don't have to test them. And the evidence that backs them is the Senza studies, and they do have the most robust number, I believe, of subjects compared to other studies overall. And their Senza RCT was in 2016 that just compared the results of the high frequency 10 kilohertz versus the traditional tonic spinal cord stimulation, and they had like 200 subjects, and they found over 2 years period that patients had a superior relief of both back and leg pain. Let's see, 75% responder rate for chronic back pain patients compared to 50%. So they just wanted to prove in the 2016 RCT Senza that they covered low back pain, basically. And then the main thing that we always think about is painful diabetic neuropathy. Nevro, yes, they were the first company that they studied this in 2021, and they had 216 patients in the RCT. They compared the SCS for painful diabetic neuropathy with the 10 kilohertz with just conventional medication management, and they found that the SCS patients had an 80% responder rate compared to only 5% in the conventional medical management group. And this was sustained over 6 months. So, I mean, these were the first guys that did the painful diabetic neuropathy, and then all the other companies are actually now approved for the same indication. So, I mean, really, the other ones would work, but this one has the most evidence, so it makes sense if you want to choose that for the PDN patients. Try not to take forever on this, but next we have Abbott. Abbott has the Burst DR technology. When I think of Abbott, or a patient that may be a good candidate for them, I think of a patient that's maybe elderly, that doesn't want to have to recharge their batteries, or if they do want to recharge, they don't want to have such a high recharge burden. They have the Eterna SCS, which is the lowest recharge burden in the market. And because it is that way, because they do burst DR, so they're not firing all the time. Think about the burden of Nevro. Because it's such a high kilohertz, they're going to be having to recharge like 30 to 45 minutes every day. So that can be a lot if you think about that. So it's something to think about. They found with the burst DR simulation, and this is probably true for other systems, right? Probably, but they found that there's a carryover effect where even if the system is turned off, patients are still getting effective treatment. We find that in just neuromodulation in general, probably. So I think, again, the recharge burden is where I would think of someone. And then of course, DRG, Abbott is the only one that does DRG. And if a patient has very focal pain, especially after surgery, like if they've had a hip, a knee, whatever surgery, that would be causalgia, right? CRPS type 2. Then this is approved for that. So if it's really just like one area, DRG is a good option for that. So that would be Abbott. And then lastly, I just want to talk briefly about Saluda and Medtronic. This is actually really interesting, and something I might want to get into more and try it out in patients is the closed loop system therapy. So all of these have their own like technologies, right? Fast, 10 kilohertz, burst, and these are consistent. So they don't change really as the patient moves and repositions themselves. And so like Saluda, if the patient coughs or bends over or turns, there actually is quite a bit of movement in the leads and in the stimulation. And this, this technology is changing rapidly every like less than a second. So like millions of times, really, literally, that the patient doesn't notice it. It's like sub threshold. And they found that there are good responses from this new technology, closed loop. And so they measure like ECAPs, what they call them, which automatically adjusts and gives the patient more of a consistent pain relief. It doesn't change as much. And in the Evoke study, they found 2-year outcomes for this study. They found that 83% of the patients had greater than 50% relief. And then they found that 60% had greater than 80% relief in their VAS scores. And they found that 0 had to explant due to loss of efficacy. And when they did the crossover study for this Evoke study at 24 months or 2 years, they were asked if they wanted to switch over to a different system, and 90% of the patients wanted to stay with the closed loop system. And then Medtronic just recently came up with their version of a closed loop system, which is Inceptive. Their results basically looked the same, mimicked those of the Evoke study. Medtronic, I think of using if the patient is going to need a lot of MRI burden, they're the best for MRI compatibility. This one is conditional upon up to like 1.5 Tesla. Medtronic's is 3 Tesla compatible. So yeah, just briefly, just wanted to talk about the systems. I personally like Boston would do Nevro and Saluda probably. DRG if they have like focal issues, or Abbott if they have a recharge burden. So again, this is all individual to the provider, but that's kind of my thought process. Let me know what you think or any questions.